meeting to order. Oh. I forgot. We're keeping the public comment in the same place on the agenda as it is?
Yes, that'll be for public comment first.
Okay. So we're going to open the meeting with the public comments right now. You'll be limited to 2 minutes. And if it gets to be too long, the general public comment sector, we will have you submit your, first of all, if you're agreeing with somebody who's already spoken, it's no need to rehash the same thing. And if it starts getting too long, you should submit your comments in writing to the board. With that note, we'll open the meeting to public comment.
All right, so first we have Wilbur Dock.
Actually, it's Bruce Manning. Wilbur Duck's a long story. So my public comment is that I would encourage you to consider a citywide mask mandate for public indoor settings. About 3 weeks ago, my son and a number of his friends were indoors without masks, no vaccine cards checked, and they all came down with COVID. So I think that it's a prudent thing to do. Again, Bruce Manning, 148 High Street, apartment 2. Thank you.
Next.
All right, next we have Sarah Hall.
Okay, can you hear me?
Yes.
Great. Sarah Hall, 8 Arthur Welch Drive. I'll start by seconding what Bruce Menon had to say. I really appreciate you convening this emergency meeting and seeing the urgency of the situation. An indoor mask mandate is easy, it's free, it's quick to implement, and the scientific data indicates that it's really our best defense against the current surge. So thank you for your consideration.
Okay. Next individual.
All right, and next we have Councilor Zede.
Hello, good evening. Thank you for hearing me out. I just have 5 points that I wish to make. First one is, my general theme is I wish you to urge caution and consideration as you proceed tonight with different ideas and thoughts. I'm not personally in favor of an indoor mask mandate, and there are 5 things that I want to tell you. Number one is, I think there are significant jurisdictional and legal issues that maybe you are prepared to contend with or maybe not. But as you know, the public health emergency as declared by the governor under the Acts of 1950 have been left to expire. So those are no longer in force. Sections 111 of the MGL has a couple of sections which some other communities seem to be referencing. But if you read the text of those, they're not enabling some of the things that you may be considering. So I want you to be aware of those. The second one is I find it to be continually troubling to treat healthy people in a way that is undifferentiated from unhealthy people, which is sort of the basis, in my opinion, of some of the public health things that we're supposed to be doing. So when you declare a blanket mask mandate 2 years into a pandemic, it's difficult because everybody's being treated the same way. Number 3 is it's difficult to see how this process or this policy or any of the policies you may set today are sustainable. In terms of a long-term view here. We've been doing this now for a while. I've joined several of these calls over the past year and a half, very similar conversations. And so that brings me to my 4th point, which is the messaging. And this was the core of my discussion or my talking, what I talked about during our last time we were sort of in this situation, which I think was around Halloween. And that's the message that we're sending with some of these policies that are being considered. And perhaps the message is that what we're doing is not working. It's not clear to me if that's what the intent is, but that's certainly how it can be read. And if what we're doing, is not working, then perhaps what we need to do is try something different. And finally, I think that this needs to be looked at the overall broad public health perspective in the context of all the other things that come with some of these restrictions in terms of impacts to the economy, to potentially bleeding into our schools and so forth. Thank you for your consideration.
All right, and next we have Councilor McCauley.
Thank you. Can you hear me?
Yes.
Just a quick point of order. The legislative session ended on December 13th, and one of the items in committee was an appointment 165. And we never got to that appointment. That appointment was for Dr. Blair, reappointment. In many ways, my question is, do you have a quorum?
Yes. We have 3 members and 2 of them are here, so that constitutes a quorum.
Yeah, but Dr. Blair, with all respect, your reappointment has died in committee.
I realize that. Oh, no, really?
Yes.
Okay, I
So,
wasn't aware of that.
so you only have 1 member.
Well, you can bring this up at our next meeting, which I believe is the 20th.
Well, at that time, we'll enter into a new legislative session, and you will your appointment or reappointment will have to be submitted by the next mayor.
Okay. Is that it?
That's it. Thank you.
Thank you.
All right, and now we have Mayor Holliday.
Thank you. I really appreciate that you responded when we had an email exchange earlier in the week asking you to schedule this meeting. I would like to make a point of clarification to what Councilor McCauley just pointed out. If a councilor does not act on an appointment, it automatically is rolled over and confirmed because of lack of action on the part of the council. So you are fine, Dr. Blair.
Thank you.
That's just a point of order. The other piece is, I understand all of these concerns, legal issues, but look across what's happening in our country, look what's happening across the state and in our own community. Many, many, many communities have stepped forward and are issuing an indoor mask ordinance. Our numbers are through the roof. They're about as high as they were last December, but we didn't have a vaccine then. This new strain is highly contagious. We know that. I don't think there's a single person who's listening to this call who doesn't know someone who's been tested positive for COVID. This is very serious. We need to get on top of this. Having so many businesses come and ask us for this because they don't want to be alone. They don't want to put the sign up if there isn't a mandate. What I have asked Frank, our health director, is that could we implement this for a month? That's all, just to get through this surge. We know there's going to be another surge of numbers after the New Year's Eve. However, I'm also hearing from restaurants that they're seeing somewhere between 50, 60, 70% cancellation of reservations because everyone is so concerned. So sitting back and doing nothing is not the appropriate role of our Board of Health, our health director, or for the last 72 hours I have as mayor. I just believe very strongly that we need to implement this mask order. We're not, as we did before when we had mandatory zones, even outside, downtown, on the rail trail, we did not set up enforcement, mask police running around, checking if everyone has masks on, but it gives a level of security to people knowing that you have to wear a mask going into places until we get through the surge of this highly, highly contagious new strain of this COVID virus. So I am asking that you please do that and just help us get through the next 30 days and then reevaluate where we are. Please. Thank you.
Thank you. In deference to the mayor, did not enforce the 2-minute length, but it will be enforced from here on out.
All right, next
Next for, okay.
we have Councillor Connell.
I assume you can hear me. Would you give me a nod if you can? Okay, thank you very much. Yeah, I would like to reiterate something that the mayor said, and that was that, yes, Dr. Blair, you are indeed still a member of the board and deemed under the law to be confirmed despite the lack of the action by the previous council. Welcome back, Robin.
Thank you.
My comment is similar to the first two and echoes some of the other thoughts that people have expressed, and they're pretty simple. And that is that we do have an exceptional set of circumstances right now. But I'm going to couch my comments in a context of having spoken with a couple of restaurant owners, two particularly, who don't want to be identified, but asked that I express their support. They're on a tightrope. And they have a hard time enforcing masking in their restaurants when people don't see a public health statement from the city. And so I understand the sensitivity of this issue. It's true that they're struggling as merchants, as restaurateurs, but I think that the severity of the situation demands some action. I know this is not a situation, it's not a decision you take lightly, but I want to encourage you to impose the strongest possible measures for as short a period of time as necessary, and give yourself the option of backing away at some point in the future if circumstances indicate that that's appropriate. So I thank you for allowing me to speak and respect the decision, whatever it is that you make tonight. Good night.
Thank you.
That's all that we have currently for public comment.
Okay, we'll close this section of the meeting. Frank, give us a COVID-19 update.
Okay, everyone, good evening. COVID-19, I'm still waiting for the most recent data, which is supposed to come out today at 5. However, let me see. All right. Our current data right now is we're at 7.12% positivity. And we keep on getting higher. I'm going to share a document with you in a second. Okay, can we do share? I'll do share screen here. Where is it? Where is it? There it is. Okay, so this is Newburyport and the surrounding communities, and the statewide numbers right here. These are going back weeks from December 2nd, and the 9th, 16th, 23rd, and actually we did get figures here. They just didn't make it to the state website yet, but they did give us our positivity rates. So Newburyport right now is 7.31%. Last week we were 4.99, big jump. Week before that, 4.76, so on and so forth. At the best of times, we were at 2% or below. So you can see how much this has increased. In addition, this graph right here that Michael came up with is the percent positivity as well. And the blue is statewide and Newburyport is in the orange. And again, you see that we actually started higher at December 2nd, kind of leveled off, but we're still at a high level. I've never seen it, this high And our cases are just coming in where we used to have 1 to 2, possibly 6 or 7. We're getting positivity cases of 20, 30, 40 in the course of a day. And I'll share that data with you too in a second. Vaccination rates look good. We have, what was that, Michael? 90, I'm sorry, 82% positivity. Yeah, 82% are fully vaccinated, and we had, I believe, 32% that are boosted as well. So, I mean, if you're just looking at numbers, numbers look good, but we, as the mayor pointed out, we need to do something else because we're doing everything we can here by offering the booster clinics that we had. And I'll talk about the testing clinics momentarily as well. Okay, so that's the data that we just saw right here. This next slide here just gives and Michael brought this up from the Boston Globe. It gives a scenario here, worst case scenario, you're going to see this red and blue dotted line here for projected cases. And the green one right here is if masks are used. So you can see the difference.
Frank, I think we're stuck on the testing data on your screen. I think you only shared the Excel, so they can't see the other slides.
Okay. Let's see. So I'm sorry about that. Let me get back in here. All right, let me stop share for a second. And then I would share screen again. How about now? Can you see the screen here?
Not yet.
How about now?
Yes.
Yes.
Okay, so this right here gives a, excuse me, outlook of projected cases per day. And this top line right here is a worst case scenario, which is what we're in right now. And if we don't use any masks, green right here, see it's a decrease of positive cases, and this is with mask use. So again, it is proven out there that masks do use, even though, you know, some people tend to think otherwise. I can bring this up with the Mayor-elect's forum here. So what we have been doing and what we're planning right now, we've done testing clinics. We did it just the day prior to Thanksgiving. We did it the day prior to our Christmas break. And we did clinics. Michael, we did clinics last week, right? Or am I getting my weeks confused with the testing?
We did the one before Thanksgiving and then the one before Christmas.
Okay, so for the month of January, we're planning on doing hopefully up to 12 clinics. And that's from our allotment of test kits that we get from, that we keep on ordering from the state. And that's been helping because we're also using it for, we just had some issues, not issues, but we have some positive cases with DPS. So today we did some testing, and lo and behold, we had 3 positive cases out of about 14 that we never would have known about because they were asymptomatic. But because it was a possible exposure, we decided to vaccinate some of the employees there and again, that goes a long way too. All right, this is the slide I wanted right here. If you can see with this slide right here, can't get the screen to go up. Okay, here we go. So for the month of December, we're already at 370 positive cases as of yesterday. So that's not including today's numbers. And you can see right here from last year, we're at 371. So we're gonna bypass that by a lot. And last year at this time, we didn't have any vaccinations. So this is all from the, the variants that are unfortunately happening. And again, to get these numbers down, I think it'd be worth our while to do have a citywide mandate. I don't know what to. So with that said, okay. The other thing that we're trying to work on getting is test kits that we can give to the general public to take-home tests. We were not one of the communities that were eligible to receive that from the state. We were not at-risk community, and we were not a community that has a high poverty rate to, which is how they make their judgment. But governor did announce that they do have, they are going to be getting some kits. So we're looking at purchasing a bunch of those for the general public as well, so they can, take it home and do their own testing. And we'll also hit the sensitive population, James Steenwell and the housing authority. So we'll make sure that we hit those that population as well. And then we'll give the rest out to the general public. So we are working on that. We're working on continuing boosters as we can. We just completed a few as well, but right now we're focusing more on getting testing done. So we at least know what our population is and who's positive out there. What else? So the other two things, again, I think that's all I have for a COVID update. Michael, I don't think I'm missing anything. Was there anything that we discussed that I?
The only thing that I don't think was talked about since our last meeting was we did do booster clinics, and we did about 600 doses between December 12th and I think December 17th. Right here in City Hall, we did just under 600 doses. I think it was 590 something.
I'm going to stop share here and get back to my regular screen. Okay. So well, that's all I have again then for the COVID update, and unless the board has any questions.
It's too bad it's trending the way it's trending. But it's throughout the state, but fortunately, we're at the low end compared to the other communities, particularly some of them surrounding us.
Yeah, I agree also. It's like we're doing everything that we can here just to be proactive, but I think that, the mask work during the summertime. I do see other communities that have implemented it. And as the mayor said, it actually surprised me a little bit, but I was getting a few calls from establishments, restaurant establishments, and even retail establishments saying, please go with a mandate, because again, sometimes they feel uncomfortable, ordering people walking into their store to have them on. People may be confrontational as well. So it seems like that we do have support. And I also want to mention that because we have not had an indoor mask requirement, we have had establishments that have shut down actually, because they did have positive cases. So I know of 3 of them right off the top of my head. And, a couple of them called me and just said, I have a couple of positive cases. I'm going to shut down, have everybody tested. So when we talk about losing business, I don't see losing business because you're asking people to wear masks entering an establishment. You lose
Yeah,
business.
sorry. We had a comment from the chat from Nate Allard. I don't know if Michael wants to read it, or he wasn't able to raise his hand, he says, from Chamber of Commerce. I could read it. You may read it. No one else can see it. This is Nate from the Greater Newburyport Chamber of Commerce. I was not able to raise hand during public comment, but I do want to express that consistency is key. Consistent policies with our surrounding cities and towns make for an easier consumer experience. Sorry to interrupt, Frank.
Okay, no, but yeah, but that's all I have to say for that matter. I know other towns have been doing it a little bit further, south. Danvers, Peabody, some towns here are considering or going to be bringing it up. But I feel my personal feeling is, let's be a leader, let's be proactive, and I feel that if we do a mask mandate, which I think is a great idea, I think that other towns will follow suit as well.
Well, I appreciate in the comment section, the couple of people that expressed their opposal to the mask mandate, but taking everything into consideration, I think this board should consider a mask mandate for all indoor activities. Sam?
Okay. So the last time we voted on such a thing was in August, and I think Councilor Zaid referenced it. It was the August meeting, not the October meeting, where there was some opposition for us to do an indoor mask mandate for municipal buildings. I just want to say at that meeting, there was some confusion as to why we would do that if the rates were low. And even at that meeting, I said the modeling showed that it was going to go up in October, as it did. And because of the infectiousness or the rate of transmission for the Delta variant, we were at the time only dealing with Delta. Now it seems it's 50% Delta, 50% Omicron. And I also said at that meeting that if we came across a variant that was able to be as infectious and evade immunity with further mutation, we would be starting over, which is what we're dealing with now. And then the comment that these measures aren't working is a lot of misrepresentation. It's just wrong. All of these public health measures are working and do work. A vaccine is a layer of protection. A mask is a layer of protection. And what you do with layers of protection is you layer them. So last year we had no vaccine, we were just masking, and that made a tremendous difference. Now doing the vaccine, and hopefully everyone gets boosted, because 2 is not enough even for the Delta. You want to get boosted. You want to boost and mask for yourself. Pretty much in general for yourself, if you're healthy, you want to be masked anyway. It's not because we're saying you are sick and we need to cover your face. It is because we need to keep you healthy, because society cannot function if our hospitals are overwhelmed. That is just the basic fact. If our hospitals are overwhelmed, society shuts down. So it won't even be about masking at that point, it'll be shut down. Okay, so that's what is at risk. So, for me, masking is no brainer. If we want to continue discussing it, fine. But it's, if at this point you don't understand, I'm not here to teach anybody. We're just going to keep going.
I understand that there are two more individuals that want to make a comment. I will allow those two individuals, bearing in mind that there is a 2-minute limit. And after those two individuals, I'm shutting down the public comment section. Okay, Michael, who is the first?
Yeah, if they want to raise their hand, I can allow them to talk. Whoever the two were. Oh, so first we have Nancy Caswell.
Hi, everyone, and thanks for meeting and speaking and connecting on the important mask mandate. I just wanted to echo my sentiment that I think it's important that we bring this into play, especially downtown. I think many of our restaurants downtown saw a busy October and saw a busy November, and are starting to see the last week of December trickle down significantly in business. I can personally attest to about half of our reservations have canceled at this point for the holiday, with New Year's upon us, in fear and worry that the restaurants will just be too busy, and asking specifically about measurements being taken within the restaurant going into the holiday. My restaurants have maintained masking. It has helped us quite a bit. We've seen minimum amount of exposure in COVID exposures. And I just think that in August, I was on the call and will admit that I was worried about the image of masking back up during the season while we still had patio and alfresco dining available. But with the current uptick and the challenges of travel and people coming back to the city as well, I think it's in our best interest, and appreciate all of you speaking and making communication as consistent as possible so we can get the message across the board.
Thank you. And
That was
one
the only
more?
one. Up and here's, there we go.
Good evening. My name is Dr. Glenn Folk. I'm the Chief Medical Officer at Anna Jakes, and I would strongly support the board's efforts to consider masking in a mandatory setting for indoor locations at this time. With the new variants that are both highly infectious and much different than the original variant, as well as the evidence we now have that the Omicron variant is able to cause infection among the vaccinated and boosted. We're seeing large numbers of patients at Anna Jakes requiring medical attention. The vast majority of our patients who are ill enough to be hospitalized are still among the unvaccinated, but there are a small number of vaccinated patients who are becoming ill because of the way this virus can evade immunity, as has been discussed. And in addition, we have two other factors that are stressing the healthcare system this year. We have a very active influenza season. We're seeing patients hospitalized with influenza. Indoor masks also are effective at preventing influenza transmission, and our workforce is diminished. We've had people who have not only become ill with COVID, but many people who have chosen to leave healthcare. And we are stressed and stretched at this time to be able to continue to meet the needs of all of our patients at Anna Jakes. We're seeing and caring for now more than 25 critically ill COVID patients in our hospital at this time. And for reference, at the end of November, our average daily census of patients with COVID was 5 to 6. So I'd strongly urge the board to move forward, understanding that this is an important and imperfect tool, but an important one in helping us get through this period. Thank you.
Thank you. So at this point, I think we should address the subject of mandates. I would like to propose that we have a mandatory mandate at all indoor venues through February 1st, at which time we will revisit this. And anybody else on the board that likes to Sam, you're the only other one on the board.
So motion to vote for mandatory indoor masks in the city of Newburyport until February 1st.
I guess we're both in agreement.
Yeah. So do I need to you then ask for the vote, Robin, or do I have to motion it and you second, or I don't know how to do this
Yep.
without Rob.
I thought we just did that.
Okay, so is it official or do I have to
It's
say aye?
official.
Okay,
Now, the only thing that come February 1st, if we want to continue, okay, wait a minute. I would like to make an amendment to that motion. That come February 1st, if the numbers have not decreased, that we consider extending that to March 1st.
so are we gonna have a meeting February 1st or prior to February 1st, or do we decide that at the next meeting?
The next meeting is January 20th.
Okay,
We can decide it at that meeting.
okay. Do we need to amend it or just wait till January? I mean, isn't it?
Let's just wait till January 20th, and then if any changes are to be made, we can do it at that point. So there's no amendment to the.
You withdraw the motion to amend.
Yes.
Okay,
Okay.
Okay, so we have it up until, just to be clear, mandatory indoor masks for all venues and establishments through February 1st, and the board will make a decision whether to extend it or not at the January meeting.
That is correct.
I want to say for all the businesses out there, any business owner listening that didn't want to, publicly say anything, I just appreciate all the hard work. I know it's very difficult to be a business owner now, and that you are not able to staff the way you want, and it's a scary time. Definitely don't want the little staff that you do have getting sick, and the board supports you.
Okay. I think unless there's anything else, I think we can move on to the next subject, which is the inauguration.
Okay, yes, just we got a call or two just regarding the Mayor-elect Sean Reardon's inauguration. From what I see, the auditorium is set up. Let me, I guess, share my screen over here. So I feel comfortable that this could go on without any issues, is what I'm saying. But share. Michael, do you have that snapshot?
Yeah, I have it. I can do it.
You mind sharing? Yeah, so let's keep it right there for a second. So here's a schedule for the inauguration day on January 3rd. In the morning, at 9:15, school committee will be taking their oath of office, and that'll be in the council chambers. Then they'll follow by the city council members. They'll take their oath of office there as well. And then they'll move upstairs at 9:40. Port media will move the cameras up there, and then the school committee and council will assemble. And there'll be small high school band will be there, some dignitaries as well. But Michael, if in 10 o'clock, the inauguration will commence. So this is the setup, and I think it's a great setup. You can see that it's spaced out between chairs. We put 3 feet, just like in a school setting. Any overflow can go upstairs, so we'll be monitoring that just to make sure that we don't have a large crowd here. And there's ample space and seating on the stage as well. So this is just to let the board know that I know some people are nervous about having something indoors, but I think that this is very manageable.
It looks like it's well thought out, and we could, unless there's an objection, we could go forward with this. Anything else to deal with the inauguration? Mayor-elect Reardon, I'm assuming you're here, and if you want to make a comment, this would be your opportunity.
Hi, can you hear me?
Yes.
Yeah, so, obviously this is what I was envisioning when I was planning my inauguration, but, it's been great working with Frank and Richard Jones and Mike Bartlett. And I do think we've come up with a plan that we can move forward with on Monday. And, this will be in the paper tomorrow as well. And so it'll be well advertised. The inauguration will be live streamed, and you can turn on Channel 9 to watch it live as well. So, I mean, people have different options. And, I also had a luncheon planned that was going to be after this that I've canceled. So on my end, I think we can move forward. I think it's still going to be a great day. And, I still encourage people to come out and take part. Thank you.
Thank you. Anything else on the inauguration?
Yeah. Yes, Dr. Blair, someone in the chat had said, will standing room be allowed? Again, the seating is limited to 25% capacity. And that is what at one point was the seating capacity for venues, and especially large crowds. I don't think it's a good idea to start getting into standing room, because people are going to be next to each other, and you need access for the bands and the color guard to come through as well. So that's why we have the overflow up in the balcony. So we won't have any chairs, from what I last saw, any like in the back for standing room as well.
Thank you. Unless there's anything else to be discussed on the inauguration, we should move on to the last item on the agenda, which deals with sickness guidance for city employees as it relates to the COVID.
Okay, I'm still confused about this new CDC guidance that the state just adopted a day or two ago. I personally don't agree with it, because now positive cases can get out of isolation in 5 days rather than 10, with no testing, mind you. So if you are a positive case, asymptomatic, then you can get out of isolation in 5 days. However, you can return to work or normal activities, but you need to keep wearing your mask for the full 10 days. And then there's the changes and requirements for the close contacts as well. Michael, if you could bring up that the matrix that we have out. I'm proposing, and we spoke to Human Resource, that we be a little bit stricter. And Michael, seeing that you came up with, can you just go over the guidance? The isolation here is on the right side, and the left just expresses the flow, how this flows. So again, in a nutshell, if we follow the 5 days, we do want testing to be done just to make sure that they're not positive. But I'll have Michael go through it.
Yeah, so essentially we kind of took a mix of what the CDC was doing along with what we thought was best for city employees, for all of city employees. So on the left, the post-exposure algorithm, this is for just exposures, not positive cases. So at the time of exposure, were you boosted greater than 2 weeks ago, have COVID in less than 90 days ago, or has it been less than 6 months since your Pfizer, Moderna, or 2 months since your J&J? If it's yes, you don't need to quarantine. You should wear a well-fitted mask around others for 10 days. And then that's the recommendation from the CDC. But what we added was a test on day 5 after exposure. If you have not been boosted or had COVID in the past 90 days, or had your primary series within 6 months for Pfizer, Moderna, or 2 months for J&J, but you have received your primary series, we're following CDC guidelines by doing quarantine for 5 days, but we again added in that test on day 5 as a requirement instead of just the recommended, because we do have the supplies to test the employees and we want their return to be as safe as possible for the entire department that they work in. And same for if you haven't been vaccinated, you quarantine for 7 days, test on day 5, and can return on day 8 if asymptomatic and a negative test. For isolation, same thing, we adopted CDC guidelines. If they test positive, they must isolate for 5 days, with day 0 being symptom onset or positive test, whichever one comes first. If they are asymptomatic or their symptoms are resolving and getting better, they can return to work on day 5, provided that they have a negative test. We did put in the special considerations for police and fire who were exposed based on CDC guidance from last week, right before Christmas, that if they are not exempt from quarantine, based on the exposure algorithm in the previous page, they can return to work if there's a staffing shortage. But they should monitor for symptoms. We'll test them on day 5, and they should wear a well-fitted mask. And if they do become symptomatic, they are to stay home and get tested. For DPS, especially with the winter coming up and snowstorms, we also added in a special consideration that if it's deemed that they need to work by the department head, that they can come into work as long as they do not come into close contact with other employees during that quarantine period, and they must wear a well-fitted mask while in public settings. And we did talk to Tony Finari, the director at DPS, about doing what they did last year, where they have the trucks ready for the employees when they come if they need to plow, and they just get in the truck and they go and they return it, and then the truck gets sprayed down with disinfectant afterwards when they return, and they don't go inside unless they need to use the bathroom. And if they are going inside, they're wearing a mask and not coming into close contact with other employees.
Well, this is the guidelines put forth by the city, and I have no issues with it. How about you, Sam?
So no, I especially enjoy that there's enough tests to test city workers. I think the biggest problem with guidelines like these that say things like asymptomatic, not everyone understands what that means. And I had a friend that is currently finishing quarantine, and I asked him if he's asymptomatic, and he said, "Yeah, I just have a cough." And I was like, "No, that's a symptom, so it doesn't count, and you have to stay in quarantine." And then he tested into his the end of his quarantine, and it was positive. So, but not everyone can do that. So right before he was about to get himself out the door, he tested and he was still infectious. So I think that's a really, really important tool that I've really loved talking about at all our meetings. So I'm just glad we do that. And I think overall, it's a great system. It's just super confusing. I mean, the flow chart and everything for lay people is just not the way to communicate, but I understand and I like it.
And we go over it with either myself or Pam will go over it in the moment with them. We did it today with someone that we tested who was exposed.
That's excellent. I'm sure that's he.
Yeah, Sam, I agree. It is really confusing too, just because now they're just putting all these, what ifs. If you have this, do this, or if you don't have this, do that. Because I was really, disappointed that they made it so confusing too. So, I'm trying to explain this even to just the general public as they're calling on businesses when they're saying that they have a possible exposure or a positive. This is what we come up with. So just having something black and white, at least that they can read down and have something just concrete that they can see. But yes, it is confusing.
So have we totally covered this subject? Then on that note, I'll make a motion to adjourn and wish everybody a happy new year under the circumstances.
Happy New Year. Stay safe, everyone, and we'll get through it again.
One other Nate has a comment from, from the chamber signage. We'll be coming up with signages ASAP as soon as we get back on Monday. But yes, we can have that, that we can share with all establishments, must be wear masks, upon entering. So we'll get all that out as soon as possible.
And we should have it in Monday's newspaper.
Just a
Okay.
quick question on that. Is there a fine on vandalization of city signs? Is there like a general fine? And if there isn't one, because I realized that a lot of those were vandalized immediately and
I'll have to look at that. I believe there's some type of punishment or whatnot in the ordinances. I'll look that up. But yes, I remember that people were taking signs down as we were putting them up during the summer.
yeah.
Okay, on that note, we will adjourn the meeting.
Good night.
Thank you, and
Good night.
Happy New Year's, everyone.
Same to
Thank you.
you.
Thank you.